In an attack on the health establishment, the group of experts suggest rates of heart disease and diabetes could tumble. And it could save tens of millions of lives and the NHS billions of pounds. They say official nutritional advice must be ignored and GPs challenged about their tendency to blithely dish out pills such as statins. Consultant cardiologist Dr Aseem Malhotra and Professor Bailey made the call in a manifesto for change. It came after overweight former pilot Tony Royle saved his life by stopping his prescription medication and ignoring official dietary advice. It saw him shed 3 stone and 8 inches from his waistline in 5 months. Dr. Malhotra said, "Here was a man who suffered a heart attack after following what we now know to be unscientific government dietary advice, but made an informed decision to dramatically change his diet and stop the cocktail of drugs he was prescribed after suffering debilitating side effects. Now his health has never been better. We have to keep reminding ourselves that good health rarely comes out of a medicine bottle." Dr. Malhotra and Professor Bailey, chairwoman of the Academy of Medical Royal Colleges, are the brains behind the Choosing Wisely movement, urging patients to continuously challenge accepted wisdom in medicine. They used heart disease, which kills about 180,000 people a year, as an example. For decades it was thought the disease was caused by saturated fat, but many experts are now convinced insulin resistance is the biggest factor. And they say there is no evidence of a single person suffering a heart attack or dying from not taking statins. Prof Bailey said, "Doctors don't always know best and shared decision-making should be given top priority in patient management." The NHS Eatwell guide, drawn up by Public Health England, says meals should include potatoes, bread, rice, pasta or other starchy carbohydrates, with lower reduced fat cheese and yogurt, and preferably unsaturated oils and spreads. Yet dietitians say the advice has replaced millennia of eating satiating, nutritious full-fat whole foods and turned us into a sugar-obsessed nation reliant on medication. Shocking statistics show processed foods now make up half the average Briton's diet, with most coming from starchy and sugary sources. More than 2/3 of men and almost 6 in 10 women are now overweight or obese. In contrast, the Mediterranean diet, rich in olive oil, oily fish, nuts and non-starchy vegetables and low in sugar, bread, potatoes and rice, is credited for keeping weight down and protecting against heart disease. Dr. Malhotra said, "Most health professionals know that 80% of cardiovascular disease is in fact caused by lifestyle factors. But most are not aware of results that reveal dietary changes rapidly reduce cardiovascular risk in addition to reducing morbidity and mortality." Basing diets on starchy foods is misguided, and in my view, has been a direct cause of the obesity crisis. For decades, fat has been demonized and led to a huge market in low-fat products. Public Health England chief nutritionist Dr. Aseem said, "Cutting out carbohydrates goes against a healthy balanced diet, which can help minimize the risk of serious illnesses such as type 2 diabetes, heart disease and some cancers in the long term." Carbohydrates should be high fiber or whole grain where possible, and sugary foods should only be eaten occasionally. Professor Helen Stokes-Lampard, chairwoman of the Royal College of GPs, said anyone concerned should seek advice from a healthcare professional. But a consultation with a GP is not an opportunity to dictate to a patient how to live their life. The manifesto is published in the pharmaceutical journal